This is KTVO's Good Morning Heartland.
More about the flu and what to look out for. We have Dr. John Collins from Complete Family Medicine here this morning. How are you doing today?
Great, and thanks for having me today.
Thanks for coming on. So the most important thing is to be able to tell the difference between the common cold and the flu. I know that some people might have, some sneezing or coughing and they automatically think they have the flu, but necessarily that might not be the case, or vice versa. So tell us, what are the different symptoms to look out for in the two?
Right, well that's sometimes a tough call to make, but the common cold generally starts with a tickly throat that becomes sore. Often we'll have some runny nose, then stuffy nose, runny nose. A fever usually less than about 100 degrees, and the symptoms usually severe-wise last 3-4 days, and then the whole thing ends in about a week or so.
Okay.
So that kind of gives us the common cold that we're used to. The flu, on the other hand, usually comes on very rapidly. You'll have often fevers of 100 to 102, and the fatigue associated with that is often very severe. It will usually stop you from doing what you would like to do versus the common cold where we kind of push through that. So those are the main differences there. Often when we find that we think we have the flu, it's best to go to the physician or your healthcare professional, because they can often do some testing in the office that will tell us whether or not you've got the flu or not.
So talk about those testings. What does that entail?
That generally involves a swab of the throat to see whether or not, or the nose, to see whether or not you've got one of the common flu types, type A or type B. We can go ahead, and the nice thing about that is we can go ahead and actually treat you if you come in soon enough. If you come in within a couple of days, there's actually a medicine that we use called Tamiflu that can actually shorten and make the severity of the flu symptoms much less.
Interesting.
The other great thing about Tamiflu is your family members and other people that might have been exposed to you can use that in a preventive nature. As you talked about earlier, sometimes there are certain groups that the flu hits most severely, and those are generally the very young and the very old, as well as those that might have some lung problems or diabetes or something that might make them more susceptible to illness. Those are the people that we'd want to also get the preventive dose of that Tamiflu.
Interesting. Now let's go ahead and talk about the actual vaccination. What is out there? I know that a lot of people think it's just a shot, but there's actually other forms of the vaccination that are offered to people. So talk about those.
Okay, sure. There's a couple of different forms. Of course, we always have the flu shot, so we get the injection, and that's pretty good for most all age groups. For the age groups of 2 to 49, there's also a mist that can be used that's inhaled through the nose, 2 sprays in the nose. And so it makes the kids a lot less apprehensive about getting their flu shot, and also there are some people that have a real needle phobia, and so that's available as well. There are some limitations to the vaccination, of course, for everybody related to having an egg allergy, and then certain populations should not take the nose spray, as it is a live but weakened virus, and most of us can take that without any difficulty, and it's about 10 times more likely you're going to be struck by lightning than get the flu from that. So it's very safe and very effective. One thing about the shot that was in the past was we used to have shots that would only last approximately 4 months or so. So we would sometimes have to judge, are we having an early season or a late season, and try to make sure that our shot covered that time frame. Now the shots last about 8 to 9 months.
Wow.
So it's very good now. Everyone can get their shot earlier in the September time frame and last them the entire flu season. So we've really made some good advances that way. Another change for this year is usually the World Health Organization, WHO, will try to come up with the most likely strains of the flu. So they'll come up with 3. This year they come up with 4, so the shot protects you from 4 different strains of the flu virus. So we've really made a lot of progress over the last few years regarding taking care of the flu and preventing it.
All right, and obviously you recommend everybody to get a flu shot. I know a lot of people are saying, "No, I'm not going to get the flu shot because I don't want to get sick."
Right, and that's a great topic. Actually, what we're doing with the flu shot is we're preparing our bodies to be exposed to the flu and then have a very immediate reaction and strong reaction, so we prevent that. So oddly as it sounds, when we get that achiness and maybe even a low-grade fever when we get the flu shot, that's actually the best thing, because that means that our body is preparing itself for an exposure. It's almost like in military intelligence. Your body's getting this information about what is likely to be seen and how to attack it. So yes, it's true. People say, I got the flu from that. That's not really the case. What they did is get a very good preparation of their body for the exposure.
And do you have flu shots available at Complete Family Medicine?
Yes, we do. Yes, we do. And the health department also has those as well.
All right. What we'll do is we'll post everything on our website at heartlineconnection.com. We'll also link up Dr. Collins' information with Complete Family Medicine if they have any questions. Thank you so much for coming on this morning.
Thank you.
And we'll be right back.